Get ready for a podcast. It's a Ken Braverman podcast where we solve the world's greatest problems. And today we're going to talk about health insurance. So get ready for that. Uh, an industry that shouldn't exist is the third party health insurance industry. These are horrible people and horrible companies. I know that that can't apply to every single person. You can't say that every person who's involved in health insurance is a horrible individual, but a good percentage of them are. And we're going to explain why in this video. And we're going to talk about what we can do as a society, as a world, as an aggregate bunch of humans that want to do the right thing for everybody, what we can do to destroy the health insurance industry and have better healthcare in the United States of America. That's the goal of this podcast today. So let's get into it. I'm your host and creator of all things insane, Ken Braverman. So let's get into this. What we're looking at a stock file with a bunch of different stocks. And I was digging through stocks and companies, stock prices and stuff like that. And I started to think about what's important in life. And health is important. And I thought about one of the biggest financial decisions that I made this year. I turned 45 at the end of July, and I decided that I was not going to pay my health insurance premium anymore. And that's kind of the opposite of what you're supposed to do as you get older, and be more responsible, because you would generally be like, well, you got to have health insurance. What if something happens? You don't want to get wiped out. And I after going through a few experiences this year and having two eye surgeries done, one a pretty extensive cataract surgery, um, and still paying out of pocket thousands and thousands of dollars and still getting bills and still paying it, um, I realized how horrible the health insurance company is in every way. In every way, third party health insurance, like your Care First, your Humana, your Kaiser Permanente, freaking everything. All of them. They're all horrible. And Kaiser Permanente is a little different, but the ones that just offer insurance and do not offer medical care, they're the ones that work with providers, but they're just the companies, right? When you pay your health insurance premium, in the case of me, it was like $953 or something. I think I was paying a month. And so at almost 1,000 a month, when you have a surgery, you don't think you're going to have to pay $3,000 or $4,000 out of pocket for a rather routine eye surgery that a lot of people get. And the reason why you do pay that, and the reason why your provider, your eye surgeon, your doctor, your qualified medical professional that's treating you, the reason why they are bald is because they've been pulling their hair out trying to get paid a reasonable amount of money for the service they provided you that you needed. And after witnessing firsthand how horrible the insurance company is at reimbursing the provider with a reasonable amount of money and then still charging you, the subscriber to their insurance, up the ass for your premium. I mean, I'm not saying you got a colonoscopy and that's what you got up your ass. No, let me cough. I'm a little sick right now. Can you tell? I got a little sinus infection. Am I going to the doctor? Hell no. But if I did, I would technically, I think, maybe have insurance right now still, but maybe not. I will pay out of pocket, and that's the only thing you can do in the immediate term to deal with the awful health insurance companies, is to stop paying them their premiums and start paying for stuff out of pocket. Now, there's a problem there, though. There's an enormous problem in doing that. One is your provider has to look at you a little bit differently than they would look at someone who's been paying a routine health insurance premium steadily for years. Because if if you are not the type of person who maintains health insurance, you probably don't maintain proper monitoring of your body and testing and vaccinations and all kinds of things that go along with being a healthier and treated member of society medically, according to the current knowledge that we have today. When you don't maintain insurance, a lot of that can lapse. Understandable why providers would be hesitant to deal with people that don't have insurance. One, for the financial burden of getting paid, and two, for just the unknown of what you're dealing with as a patient as well. So, what is the solution for people like myself that understand, people like you too, people like everybody, anybody who realizes that there's a wealth of information out there and artificial intelligence now to perform a lot of the services that a basically trained resident type medical professional can do. And I find myself treating myself, searching things, and learning about the human body. And it helps you make better decisions about when you need to seek treatment and the types of treatment you might be getting. All of that being said, what do you do with someone like me who's not like I don't want to become one of these uninsured burdens on society. I just want to pay the provider a reasonable amount of money for the service provided and not have them deal with the insurance company. I would have loved to go to my cataract surgeon earlier in the year and been like, if I'd known this, right? If I'd known that the $1,000 a month I was paying in premium was going to result in me still paying 80% of the cost of the freaking surgery out of pocket anyway. If I had known that, I would stop freaking paying that insurance earlier in the year. But I would have gone to my surgeon and say, listen, I'm not a bad human being. Like I'm not injecting myself with heroin all day. I'm a healthy person. I just have a cataract in my other eye we need to take care of. Can I just pay you like 5 grand to do everything? Here you go. Can I pay ahead of time? I would have saved money if I had done that. And my provider, instead of getting 1,100 bucks for everything, would have ended up getting 5 grand. And the health insurance company would be the one that's out of business because they're effing over all of us. They are screwing our providers and they're overcharging us. And their sole job is to make sure that they keep money and people don't get paid for the service they provided. That's all they do. All right. So this goes out to Trump and it goes out to Kamala. It goes out to both of you. Kamala, I would expect to take the lead more on this, which is how about in Biden's lame duck several months here, Biden writes an executive order and gives everybody public option Medicare for all. All right. With this condition, with this condition, if you're going to do anything first, you got to like log in with your phone, get a plan with the government, and you have to answer AI questions to determine your health. Now, that sounds kind of scary. I agree. It sounds a little weird. Like you're going to be giving a lot of stuff up to the federal government, but guess what? There's no privacy anymore anywhere. Just deal with it. Welcome to 2024. Welcome to everybody's interactions being recorded all the time. You don't know what cameras are on you all day. You have no idea. They're everywhere. And everything on your phone is probably being monitored by the Chinese and the Russians. You got no privacy. So why even worry about it? Don't you want to know if you're having a heart attack right now? Don't you want to know if you're having a stroke right now? Don't you want to know what your blood pressure is? Don't you want to know how you're doing? Why can't we just log in and let the robots take over with that and help us out? It sounds obvious at this point. So what I think you can do here is an AI infused public option Medicare for all that gets everybody seen and rudimentarily treated, like meaning like there are people that are suffering with very curable situations, like really inexpensively curable situations, that are not going to the doctor because they just don't want to worry about the money, don't have insurance, or don't like their insurance. Reasons I've detailed before, even in this video, talking about weird situations where people can happen where they just avoid helping themselves out and getting checked out by a medical professional because they're concerned about the cost and sometimes they're just concerned about the answers. Well, we need to now change how we deal with public health because we have too many people, not enough providers, and we're dumping all of our money into a part of the industry that doesn't even generate any benefit for the world. Meaning there is no benefit when it comes to somebody negotiating how much somebody else who performed a medical procedure on you that you needed. Like, say you had a heart attack and you had a quadruple bypass and they had freaking 5 surgeons with their fingers in your chest, right? And you survived because they gave you some new valves, right? and they're charging $35,000 for the surgery, and your insurance company's giving them four. I would tell the insurance company to go out of business, and I'd have the federal government come in there and pay the doctor 20, right? That's what you do. And there, there's resistance on a few different sides to that kind of thing happening because the providers are afraid they're not going to get paid enough by the public option that's created by the government. And the insurance companies are like, we're going to be out of business. So we better lobby Congress and make sure that they don't do anything here. And we let the insurance companies manipulate our representatives because they're an extremely strong lobby. They need to go. Like, we need to attack the third party health insurance industry from all sides. We need to offer AI public option. We need to have mass protests where people just don't pay their premiums like the last 3 months of the year or something. Like, so let's really cut off their fucking balls. Like, this industry needs to die. All right. The people don't need to die. The industry needs to die. There's a reason why other countries do not have third party health insurance. And just like you go to Europe, you go to different places, everything's covered. Canada, freaking Canada. Like, you can buy supplemental insurance if you want more than the government offers, but everyone like gets seen. Like, there might be a wait, yeah, but the weights will go down because you're going to have AI helping the process. So you've got extra arms to help with the system. You don't even need as many human bodies as you used to. Point is that I'm just so disgusted with the impact that this industry has on this country that I want to see them gone, which is why I focused this video today on this topic. When normally I'm talking about sports betting and rollerblading around the freaking country and doing all kinds of different stuff, but this is important and it's doable. Like, it makes everybody better off when we destroy third party health insurance. Everybody. Because there's more reliability in our healthcare. Providers are going to understand what they're getting reimbursed more. And it urges this fundamental shift that we need to take into AI assistance, like artificial intelligence and the ability to harness and sift through large swaths of information with intelligence is an enormous breakthrough when it comes to universal style healthcare, right? One of the things that doctors get trained on, even though I've never been to medical school, but I'll tell you, is like, don't ever make things worse. That's like number one. Like, don't make things worse in your treatment. But also, you have to understand by looking at a lot of different factors what's going on. And the human brain, it's not really great at understanding 100 different things going on, samples or sensors of 100 different measurements and throwing them all together to come up with a diagnosis instantly. The human brain has to require time to analyze and assess and ask questions and proofread, right? Robots and AI in the sense, they're awesome at looking through large swaths of information and finding patterns and finding correlations and doing checks. It's awesome. So, don't you see a world where people go in and get a blood test and get a bunch of vitals taken and answer a bunch of questions? And literally, the AI is tracking this as you go and is narrowing down the things that you need to be focused on. Like, they're like, all right, let's see, what's this person's pulse? Okay, 68, awesome. What's their blood pressure? 135 over 89. Ooh, that's a little high. Both those numbers are a little high, but the 89 is especially on the diastolic, I believe. That's a little high. We need to we need to check this box now on potentially high blood pressure and potentially high blood pressure related diseases now all of a sudden because we're picking up on some high blood pressure right now. What else we got? Let's do a blood test. Let's start testing like a blood platelet counts, and let's test for all these different diseases, and let's test for vaccines, for antibodies to certain stuff that's in the environment. Like, let's test for a bunch of different stuff, and as those results come in, that gets fed to the AI, and the AI is just making a further and further more detailed diagnosis about what potentially is going on, all without any necessary human involvement. None. Just the human that goes in to get tested. I mean, think about your Big Hero animated movie or whatever. Just think about, it doesn't have to be a personal assistant right next to you, but it surely should be a machine. Meaning, you're going into, like, imagine there are like 7-Elevens everywhere, and inside a 7-Eleven, instead of a slot machine, there was a big egg that looked like an old telephone booth, like a red telephone booth, shaped like an egg, and you're sitting inside there and you're getting all your vitals done. It's like a self-cleaning AI robotic assessment diagnostic, porta potty type thing that you sit in, right? And you'd get all tested out, and it would be free because everybody would have the freaking plan with the government. Everybody would have universal health care. So you just walk in and you flash your phone number and you do a code, and all of a sudden, next time you know if you have AIDS in 15 minutes. Like that's the world we should be living in. Uh, it's obvious to me, like because these companies getting in between making ourselves healthy. Do people look healthy in America? I travel a lot of America. You know what I see? I see a lot of bad food and a lot of fat people. That's what I see. And a lot of fat people with terrible health insurance, not getting good advice. How about we do something about that? And it starts by offering people free ability to get checked out, hopefully by humans, but also by robots. So let's get on that. That's what I'm going to get on talking about. Is let's get on that. So if you see me launching a robotic health insurance company, you know what happened. No, sorry, just robotic. Yeah, I guess it would be a health insurance company in a way, um, but not in the sense that it's only dealing with screwing providers out of money. It's a health insurance company in the sense of you want you want to get treated and you want to get it done right and you want everything to be reasonable and you want it to be transparent and hopefully inexpensive or as inexpensive as it can be. That's the kind of health insurance company that I would create. However, the federal government, believe it or not, will be able to do it a whole lot better simply because of the economy of scale and the desire of government, hopefully, to provide for the people. That's what something that kind of gets lost in our political rhetoric sometimes is that the government is there to help us. I know a lot of us think that the government is here to spy on us and ruin our life, but generally the government's actually there to help. And a lot of times it does. And in this instance, it could absolutely help. So, Don or Kamala or both of you, universal public option tied to AI advancement and engagement and investment and getting everyone seen by someone with a pulse or somebody who wants to be sentient like a robot, perhaps. All right. Good luck, everybody. Have a good day. I hope you feel healthy. And I hope you don't have to take advantage of the medical system today. And if you do, I hope it's a pleasant experience. I would like to end on this. While I did pay thousands of dollars for my eye surgeries, I can see again. And what prompted me to do this video was kind of like I was saying in the beginning was I saw how my provider was getting screwed, and that is what infuriated me. Was this man made it so that I am 45 years old, and instead of being blind in at least one eye and probably both eyes for the last 20 years, which could have been the case, I could be blind 20 some years into 25 years. Sorry, 27 years, 28 years. I could be into being blind already, and I'm not. I can see like 2020, 2025 even. And to deprive people that are providing that kind of service to humans in on this planet, to deprive them of appropriate financial compensation because it's your business to deprive people of compensation. That's what you do. That's so infuriating that I had to do this. And I have to find a way to destroy them because as I said, it's an industry that should die. It does not help anyone. Anyone. You heard me? Please, in the comments, if anyone can come up, tell me something that health insurance does right that helps, right? Okay? Tell me something that health insurance does. Third party, like your Care First plan, something that they do that the government couldn't do, number one, and that they do better than the reason why the industry exists. I'd like to know what the answer to that question is. Because according to my logic, all they do is deal with finance and coverage, and people should have the right to get better. So there shouldn't you should have a right to get treated. Everyone, and in many ways, you do. If you walk into a hospital and you're having a heart attack, oftentimes they will do something for you, even if you don't have insurance. So you should have a right to treatment regardless. That's what we assume all humans should have that right. So what is it that insurance companies actually do other than steal your money and then not pay your provider? What do they do? I'm open to negotiate that point with anyone in the comments. In the meantime, let's just destroy them because they shouldn't exist to begin with.